All right, welcome back. There are a lot of questions about the coronavirus out there, and there's also a lot of misinformation. That is why we are going to an expert. Dr. Robert Healy from Carle joins us now. Thank you so much for being here. Really appreciate it. So now, so many things are being canceled, and people are realizing, okay, this could be in our community.
Right.
Not a lot of people are getting tested at this point. So number one, I guess I'm thinking, if I have a cough, if I have a fever, what do I do? Do I call? Do I go into a doctor? What's my next step?
Right, and it's confusing because the symptoms of the flu and the symptoms of this new COVID-19 disease are pretty much the same at the start. So I think the first thing we want to stress is don't just come into the office, don't come into urgent care, convenient care, or the emergency department. Call us. Call your local call your provider, ask them what you should do. I have X, Y, and Z symptoms. We'll help to triage, which means to figure out what's the best place for you. A lot of people we're going to tell, stay at home. It sounds like you could have the flu or another respiratory infection. Stay home, plenty of fluid, ibuprofen, acetaminophen, things like that for fever. If you have certain symptoms that would make us want to see you and possibly do some testing on you, we'll have you come in.
What would those symptoms be?
So a high fever, a pretty bad cough, anything like chest pain or something like that could be something else.
Shortness of breath?
Shortness of breath, fever, and a cough are the hallmark symptoms of the new disease.
If I want to get tested, can I? Does Carle have tests? How many do you have?
Carle does not have tests. Nobody in this community has tests. The state has tests. We've tested some people. I think I should say one thing first, which is that we don't know of any cases in our community. Right. We've tested people. They've all come back negative.
But you just said you don't have tests. You do have tests?
The way we can order tests is by talking to local public health. And if people fit a certain criteria, they've traveled recently from a country that's on the list from the CDC, they know someone or have exposed to someone with known COVID-19, or they're in the hospital, they're real sick, and they have an infection, we can't tell what else they might have, everything else is negative. We call public health, we go through a discussion with them, and then they approve or not the testing. If they approve it, we can send it through public health and get a result. If they don't approve it, we have an option now of sending it to an external lab. LabCorp, Quest, a few other labs are taking samples from us and others in the community, but the turnaround time is proven to be long, 3 to 5 days.
In your opinion, should people be restricting what they do in any way beyond, say, okay, these large events are being canceled.
Right.
But am I going to see a movie? Am I going to see going to the grocery store?
Yeah.
What should we be doing?
I think we should be listening to what public health tells us. I think we should be restricting our activities, not going into large groups. What does that mean? I'd say
it's very vague.
It's very vague. If you're going into a group of 250 or more inside, I wouldn't do that. I would just put that off for now. That's why they're canceling all their basketball seasons, etc. If you're going to be out and about, I think try to keep a safe space away from people, 3 feet away from people, up to 6 feet away. That's pretty hard to do. Things we can control are our own hygiene, washing our hands frequently. There's shortage of the pumps and the alcohol-based material. Use plain old soap and water. It's perfectly good. It's actually better. For 20 seconds, wash your hands all over every surface. Try not to touch your face. It's incredibly hard not to.
Okay.
If you do, wash your hands. And try to clean and not touch so much common surfaces like doorknobs or surfaces.
Okay, and we have to ask these questions because people, we just want to be sure we're putting the facts out there and not scare people, but the facts and the information are important.
Correct.
Doctor, thank you so much.
Thank you.
We'll be right back.